This is a case of a very advanced keratoconus with corneal scar, deep ectasia, residual corneal stroma of about 100 to 140 microns at the inferotemporal apex. He has undergone a penetrating transplant with another surgeon across the country in his first eye and is very disabled by it. Following my corneoplastic principles, I decided to perform a hand lamellar transplant to remove the scar, replace tissue, add strength for future laser surface ablation following his cataract surgery towards our goal of emmetropia. I'm using the Moria 1 tree find that allows me to predetermine my depth of definition so I can remove the recipient corneal tissue enough to remove the scar and yet not penetrate this very thin cornea, while use a deeper tissue from the donor to replace the strength of this cornea. I usually do not like sharp instruments on the cornea, but cases like this where the cornea is extremely flimsy and thin, you rather be sharp than use pressure, at least to begin the dissecting pocket. I'm now proceeding with a blunt multi-directional modified tooth blade of my own design to help me dissect this cornea coming in from the periphery and lastly to the center scar area where you can see these adhesions that I'm carefully separating by using resistance to prevent tearing through the stroma close to desmase, as you can see here in this ectatic area. I'm now creating the peripheral pocket for a good fit for the donor cornea. Anti-torque 8-bite running suture following 4 stabilizing sutures to a complete lamellar endpoint. Roger, keep your chin right there. Wonderful. Open your eyes. After surgery, we did the lamellar transplant. Open your eyes wide. Wonderful. Looks nice and clear. Very well settled. Fantastic. How do you feel, Roger? You've had a lamellar transplant?
I feel fantastic. I can see already again. I'm back to active working, having a great time.
Really?
Yeah.
So you feel it was worth doing this lamellar surgery?
I think it was fantastic, and I don't think anybody else could have done it but you.
Thank you so much. Thank you.
He was told that it was going to be a full cornea transplant, and I'm delighted that we didn't have to go that route. I'm glad about the layered approach, because look at this, not 6 weeks out of surgery and he was able to drive the camper all the way up to Washington and back again. I'm not allowed to drive the camper, so
No, she's not.
we wouldn't have
She
been
told on you.
we would not
She's
been
not
able
allowed to drive the camper.
we would not have been able to make this trip if it hadn't, and I can put him back to work, by golly.
No, this was fantastic. I can't believe the outcome of the surgery. It was fantastic. Went back to my eye doctor to have the Band-Aid changed on it, and he pulled in his entire staff and said, and showed me off to everybody. They could not believe the beauty of that workmanship. I mean, it was fantastic. They were really, really happy and surprised, and you definitely deserve your reputation.
You know, Dr. Gulani, the thing that impressed me the most is that he is already starting to see better than he could see prior to this. Now, he had had a cornea transplant on the other eye, so we know what a long process and healing process that is. It took well over a year before he could go back to being himself and living his life, and here we are just 6 weeks out.
I'm already
Doing
starting
great,
back
and
to
he's
work.
seeing well.
Roger, it's been a pleasure. I know all that discussions we went through. Pardon me, but I have to, because I believe in the elegance of surgery and I fight for it. So seeing you like this is mind-blowing for me.
Believe me, I will tell anybody and everybody about you.
Thank you again.
Nobody to go to but you. Thank you so much. I really love you for what you've done for me.
My pleasure again.
Thank you.
Lieutenant, it's been a pleasure.
Thank you
Okay?
so much.
Come with me, please.